Alrighty, it is 1:30. You all can see and hear me, right?
Yes, I can hear you. I can
Okay,
see.
good. Good. Good afternoon, and thank you all for joining us today for the second social equity excise fee hearing of 2026. I want to begin by sincerely thanking everyone who has participated so far, and those who are prepared to share comments today. Your feedback is immeasurable to this process, and the time that you're taking to show up to engage helps us share real recommendations that will impact communities across New Jersey. Reinvestment dollars are one of the core pillars of equity work, alongside licensing access, business opportunity, access to capital, and education. And how these funds are used matters. They can help repair harm, expand opportunity, and build long term stability in communities most impacted by the failed war on drugs. Across the country, states are putting cannabis tax dollars to work in ways that transform communities and expand opportunity. We have seen what is possible in other states. In Maryland, for example, cannabis reinvestment funds are supporting community-based programs in low-income and disproportionately impacted neighborhoods. In New York, reinvestment dollars are funding youth services, housing support, workforce development, harm reduction, mental health care through grants to local nonprofits. Connecticut is using its funds for economic development, reentry support, youth programs in communities with the greatest historical impact. And Colorado has invested cannabis revenue into education, school construction, health and mental health services, substance use prevention, and grant programs that expand access to opportunity. New Jersey, once again, has the opportunity and the responsibility to define its own path, and that is why your voice is essential. So we encourage you to continue engaging with us. Our final CEIF hearing will take place on Thursday, January 29th at 2 p.m. Anyone who may have registered for today or last meeting and you missed your opportunity are welcome to re-register before the January 27th deadline for the January 29th final CEIF hearing. And as always, please submit your written comments. And if you aren't able to join us virtually and live, you have until Friday, January 30th at 5 p.m. to do so. So finally, this process does not end today. Continued engagement, including staying connected with your state legislators as recommendations move forward, is critical to ensuring these dollars are invested in ways that are truly reflect community needs and priorities. Thank you again for being here and your commitment to this work. And with that, it is my pleasure to introduce Commissioner Matt.
Wow. Good afternoon, everyone. And thank you, Director McWhite, for your great introduction and informative information that you just espoused. Now, I know I'm going to be repeating a lot of the same things you said, but it's better being said twice than never at all. As Director McWhite said, I am Commissioner Amelia Matt, and I want to thank all of you for joining us today for the second of three Public Engagement and Education Committee scheduled hearings for 2026. I must at this point also acknowledge that this is the second hearing for 2026 and the first for the Sherrill administration. And I want to say that we at the CRC are looking forward to working with the administration and to continue the work that the CRC has been doing so far. The final scheduled hearing for 2026 is set to be held on Thursday, January 29th at 2 p.m. The Public Engagement and Education Committee is statutorily required to hold at least 3 meetings per year in order to solicit input from the public regarding the use of social equity excise fees. The goal of the committee is to give a brief overview of CEIF, listen to your ideas, gather your suggestions, and provide you with the process for which your valuable ideas and suggestions are communicated to the governor and the legislature. The Cannabis Regulatory Enforcement Assistance and Marketplace Modernization Act mandates the legal and regulatory framework for recreational cannabis in the state of New Jersey. The CREAM Fund is a special fund where all tax revenues, fees, and penalties from regulated adult use cannabis is deposited. The CREAM Act also established a fund which specifies where the money is collected from tax revenue, fees, penalties, and other sources, and provides provisions that separate the revenue derived from the social equity fees. These fees are to be appropriated annually, and it is suggested that at least 70% of the tax revenue goes towards investments in impact zones, assisting with loans, grants, regulatory and administrative costs, municipal reimbursement for drug recognition expert training, and financial assistance to residents of impact zones. The social equity excise fee is a fee imposed on every licensed cannabis cultivator of adult use usable cannabis which is sold or transferred to other cannabis businesses. This fee does not apply to medical cannabis cultivation. As for the use of the C funds, currently, as required by law, these funds are to be used for social equity initiatives, which will benefit communities that were disproportionately affected by the war on drugs and the individuals who live in them. Some of the suggested program recommendations are listed here, and they are apprenticeships, job skills and readiness training, food assistance, reentry and rehab services, expungement clinics, and financial literacy programs. Some of the potential investments and possible services for health and wellness suggestions were grants and loans, financial assistance, economic development, youth recreations, substance use disorders, and mentoring. These are only a few of the ways that CEF funds can be used to improve the communities, thereby improving the lives of its residents. Now, this is where you and your valuable input is absolutely necessary. We want to hear from you. We want you to share your ideas and your suggestions. Your role today is a conversation. This conversation is about you. We are here to listen to you and document your ideas and suggestions. And our role is to provide you with the forum to have your voices heard. And we do that by holding a minimum of 3 of these listening sessions per year as mandated by the CREAM Act. We will use these hearings to gather your recommendations and create the report to be submitted to the governor and the legislature. The social equity excise fee for 2026 is the same as it was for 2025. There's no increase, and that fee is $2.50 per ounce of usable cannabis. This slide is a snapshot of the unconfirmed total dollars for cannabis sales for 2025. The amounts may vary upon confirmation, but that should only be by a very small percentage. The recreational sales were approximately $1.1 billion. The tax revenue was approximately $68 million, and the CEF amount was approximately $10.7 million. This shows the growth of the market and the direction that the New Jersey cannabis industry is going. Now, this is where you and your valuable input is absolutely necessary. We want to hear from you. We want you to share your ideas and your suggestions regarding the use of the CEF funds. Kindly begin by providing your name and organization, your municipality and your county of residence, and definitely your ideas. You will have 3 minutes to speak, and you can also submit your ideas electronically if additional time is required. We ask that all comments be submitted electronically, whether or not you have had the opportunity to speak. As a reminder, your comments can be submitted via the link njcrcgov.info/SEEF. I will now turn today's session over to Dara, who will guide you through the public comment portion. To you, Dara.
Thank you, Commissioner.
You're welcome.
As we open the floor today to the public comments, we also encourage you to submit written public comments, as the Commissioner just stated, and the deadline to do so is Friday, January 30th at 5 p.m. Written comments will be shared with the Commission members, and it will become part of the public record. Speakers are limited to 3 minutes, and I'll call on the name of each of the registered speakers. If you're calling in by phone, you can press *9 to raise your hand when you hear your name, and then *6 to unmute yourself. I will try to give you a 30-second warning when you have 30 seconds remaining. Okay, we're going to start off today with George Worley. If you're in the room, please raise your hand. You can press *9. George Worley, or Worsley. Okay, moving on. I will go back around to all of the speakers. So if you don't get a chance to hear unmute yourself, I will go back around. Prince Abadoye. Prince Abadoye. Benjamin Guy. Benjamin Guy. Linda Brown. Okay, Linda, I see you.
Hi, can you hear me?
Yes.
All right, great, thank you. Good afternoon. My name is Linda Brown, and I'm the Executive Director for the New Jersey Association of County and City Health Officials, or NJACO. NJACO is a statewide organization serving local health departments in New Jersey, and on a personal level, I live in Somerset County. I thank you for the opportunity to provide feedback for your recommendations for the social equity excise fee. Public health is rooted in understanding communities, leveraging resources, partnerships, and local resources to help fill gaps. Local health departments are so often invisible to many of their communities, but are providing incredible services and investments to meet acute and chronic needs. Health departments in New Jersey have a variety of sizes and structures, but they're all statutorily mandated to provide the same core services. Here in New Jersey, we have 103 local health departments. These include municipal, city, county health agencies, as well as our regional health commissions. Understanding the importance of the impact zones for the allocation of the CEEF funding, I wanted to provide some context and a snapshot of the way our system works and how more than 40 of our health departments serve these impact zone communities. In some areas of the state, like the southern region, we have predominantly county health departments. For example, Burlington, Camden, Gloucester, Atlantic, Cape May, and Salem counties are served exclusively by county health agencies, serving nearly 1 million impact zone residents. In other communities, there is a mix of health departments, or other counties, there are a mix of departmental structures. For example, in Union County, in addition to the county health agency, we have 8 additional local health agencies serving municipalities. For Union County, half of these health departments are serving more than 250,000 impact zone residents. While the geography served and the population targeted is while the provided services may differ slightly, local health departments are providing a really important opportunity for the CEEF funding. In 2025, NJACO conducted a costing assessment for our local health agencies with the goal of understanding the monetary gaps. The results did not surprise us, and the gap is substantial. The estimated annual gap for funding the funding needs was assessed at $83.6 million. And at this time of the assessment, nearly 1/3 of the departmental budgets consisted of COVID-era crisis funding. Nearly all of these revenue streams are gone or will be soon, meaning that an additional estimated annual gap of $63 million remains. These gaps, we know, just simply cannot be absorbed by local tax dollars. Local health departments play pivotal roles in building healthy communities. They're direct service providers, policy drivers, educators, and community connectors. So often we hear that they are the only ones that answer the phone. They work to provide support and get answers for the residents. And this matters because they have a pulse in their community and they care deeply about meeting residents where they are. Local health departments are grounded in principles of equity and they have a long-term service to their communities. I'm here today to ask for a consideration of the substantial investment of the C funding to local health agencies to help expand on what they already do. Thank you.
Thank you. Moving on to Paul David Roman. If you're in the room, you can press *9 to raise your hand. Paul David Roman. Christopher Keim. Christopher Keim. Stephen Van Olen. Stephen Van Olen. Daria Crooms. If you're in the room, please press *9 to raise your hand. Okay, I see you, Daria.
Good afternoon, commissioners, and thank you for the opportunity to speak today. My name is Daria Crooms, and I am the owner of Capstone LLC and the co-founder of Cannabis Innovation Lab. I wanted to start off by acknowledging the thoughtful recommendations shared at last week's hearing, particularly those focused on public health and the arts. Those sectors are critical, and I support their role in repairing harm and strengthening communities. Today, I want to offer a complimentary and I believe fiscally strategic recommendation. The social equity excise fee, currently $2.50 per ounce produced, has generated an estimated $10 million in revenue. This fee was created with intent. It was not simply designed as a general revenue source, but as a tool to support social equity within a newly legalized industry. My recommendation is that the seed funds be retained, or at minimum, that a significant portion be reinvested directly into social equity operations and license holders within the cannabis industry itself. From a budget and treasury perspective, this is not an expense, it is a reinvestment strategy. New Jersey's cannabis market is still in its early growth phase. Social equity businesses are navigating capital constraints, regulatory complexity, and operational barriers that directly impact their ability to succeed, scale, and ultimately generate sustained tax revenue for the state. If we want this industry to reach its full economic potential, if we want stable operators, long-term job creation, and consistent downstream tax receipts, then the state must invest in the very businesses it has licensed to deliver those outcomes. Reinvesting seed funds into technical assistance, operational infrastructure, workforce development, and compliance support for social equity licensees strengthens the industry's foundation. It reduces failure risks, increases survival rates, and improves the state's long-term return on investment. Just as importantly, it signals something critical, that New Jersey is committed to its social equity stakeholders beyond licensure alone. That commitment builds trust, strengthens compliance, and creates healthier relationships between regulators, operators, and communities. A strong cannabis industry benefits everyone. When social equity businesses succeed, the state benefits through expanded tax bases, stabilized revenue streams, and economic activity that compounds over time. In short, reinvesting C funds within the industry aligns with sound fiscal policy, responsible treasury planning, and the original purpose of the social equity in cannabis legalization. Thank you for your time and consideration and for your continued leadership in shaping a cannabis industry that is equitable, sustainable, and economically strong for the state of New Jersey.
Thank you. Moving on to Diego Segura. If you're in the room, press *9 to raise your hand. Diego Segura. Tynesha Gibbs. Okay, I see you. Tynesha, you should be able to speak now.
Thank you. Good afternoon, everyone. My name is Tynesha Gibbs. I am the Director of Policy and Youth Advocacy at NJSAC. We are New Jersey's after-school and out-of-school time professional network. Thank you for the opportunity to testify before the New Jersey Cannabis Regulatory Commission. New Jersey has a critical opportunity to invest in youth and communities by allocating SEAF, a social equity excise tax revenue, toward after-school and out-of-school time programs. The voters of New Jersey have spoken clearly. According to a 2023 Rutgers-Eagleton poll, when asked where they would like to see tax revenue generated from cannabis sales spent, half of New Jerseyans agreed that the state should invest in education. Directing these funds toward after-school programs aligns with public sentiment, reinforces social equity efforts, and addresses pressing community needs. After-school and summer learning programs play a vital role in youth development, providing safe, enriching environments where young people can build relationships with mentors, develop decision-making skills, and engage in positive activities. These programs are especially crucial in communities disproportionately affected by past federal and state drug policies, poverty, and crime. Research shows that structured after-school programs reduce the likelihood of juvenile crime, substance use, and risky behaviors during the critical hours of 3 p.m. to 6 p.m. Investing SEAF funds into OST programs is not just a moral imperative, it is a financially sound strategy. Every dollar invested in after-school programs yields a return of at least $3. Additionally, students who participate in after-school programs are 50% more likely to finish high school, which in turn helps to save an estimated $390,000 to $580,000 in loss of productivity incurred by each high school dropout. Specifically, we have seen several other states that are using these funds in order to support after-school and out-of-school time programming. Alaska, California, Vermont, Colorado, and New York have already linked revenue from legalized marijuana sales to after-school and out-of-school time. New Jersey is well positioned to follow suit. For teens and older youth, the hours between 3 to 6 are the riskiest hours when juvenile crime, victimization, and drug use peak. Older youth who do not participate in structured activities after school, like after school programming, are 3 times more likely to participate in risky behaviors. So OST is not only a protective factor, but it builds protective factors. If New Jersey is considering the use of tax revenue to repair harm done to historically marginalized communities hit hardest by substance abuse, then OST programs provide effective solutions for youth development and success. We're specifically asking for a grant program, a community reinvestment grant program, to support the goal of after school and out of school time across our state, which is also supported by the NJCRC recommendation on youth services made in February 2023. And lastly, we are also asking for these funds to support and sustain the out-of-school time and future teacher workforce. And I will submit the rest of my statement in written form. Thank you so much for this opportunity.
Thank you. Moving on to Nichelle Santos. Nichelle Santos, if you're in the room, you could press *9 to raise your hand. Shirali Patel. See you, Shirali. You should be able to speak now.
Good afternoon. Thank you for the opportunity. My name is Shirali Patel on behalf of Blaze Responsibly. I'm an attorney with nearly a decade of experience in cannabis and advocacy, and I submit these comments on behalf of the communities that are still waiting for New Jersey to fulfill its promise of restorative justice. Since 2022, the state has collected millions in SEAF revenue, yet to date, no SEAF dollars have actually been spent. Every day that these funds sit idle, it's another day that our communities don't receive the repair that they were promised. This commission has the opportunity to truly establish a national model. How we deploy these resources will determine whether cannabis legalization becomes a tool for justice or just another broken promise. Drawing from the experience that I've had with the community, I think there's 3 priorities that the funds should be utilized towards. One, which I think is happening in part, is direct business support to really make social equity a reality for so many. If we look at states like Illinois, they licensed over 500 social equity businesses, yet not even half are operational, and that's because of a lack of capital. Our state can't repeat these failures. We need to have zero interest forgivable loans, specifically for social equity applicants with cannabis convictions or from disproportionately impacted areas. There needs to be grants covering licensing fees, compliance costs, and first-year operational expenses that entrepreneurs genuinely struggle with. Workforce development partnerships with community colleges for cannabis industry apprenticeships and cultivation, retail, all the license categories, so that folks can climb up the ladder. Hiring incentives for businesses that are employing individuals with prior cannabis convictions could go a long way as well. The other category I think that needs support is expungements and legal services. Tens and thousands of residents are still trapped in a cycle of paper shackles. They're waiting to get clear records but cannot afford them. And because they can't afford them, they can't secure proper employment, housing, or rebuild their futures. I would recommend that funds be utilized to partner with or provide grants to community-based organizations already doing this work on the ground to fund us to expand capacity for free expungement clinics throughout the state. This will help support the infrastructure rather than creating new bureaucracy. Organizations with established trust and impacted communities can move faster and more effectively. And lastly, I think what follow other states lead. Arkansas, for example, they take their medical marijuana taxes and they fund a free breakfast and lunch program to every public school student. If we can allocate C funds to guarantee free breakfast and lunch for New Jersey students and communities disproportionately impacted, regardless of federal program eligibility, we can really guarantee that no child goes hungry. And without transparency, these are just empty gestures. So I do think that there needs to be accountability built in, an independent oversight committee, public dashboards showing real-time allocation, measurable outcomes, and of course, community engagement like you guys are doing today. I will submit the rest of my comments due to time. Thank you.
Thank you. Next up, we have Donna Lisi. Donna, if you're in the room, you can press star 9 to raise your hand. Donna Lisi. Okay, going to Stephanie Carey. Stephanie? You should be able to talk, Stephanie.
Thank you. Good afternoon. My name's Stephanie Carey, and I am the chair of the New Jersey Public Health Council. Today, we're talking about the best way to allocate dedicated social equity funds, and I'm here to tell you that public health is equity. We know that time and time again that disparity upon disparity are piled on the same neighborhoods, and neighborhoods that are underinvested in are the same neighborhoods that face the highest rate of diabetes, premature death, infant mortality, and other terrible health outcomes. We know we need to go upstream to address the root causes of those health disparities and provide equitable access to the means to achieve better health. Local health departments of New Jersey work daily to improve the health of neighborhoods that bear a disproportionate share of the disease burden in our state. Health departments save lives by preventing disease outbreaks, improving access to care, and assuring clean water, safe food, and safe housing in every neighborhood. But because health departments prevent bad outcomes, their work remains invisible and has historically been underfunded. A 2025 analysis of local health agencies in New Jersey showed that there's a statewide gap of about $83 million annually in local health agency budgets to achieve national foundational public health standards. Local health agencies in New Jersey also operate with about a third fewer staff than agencies in peer states. There are missed opportunities to improve maternal child health, chronic disease outcome, and emergency preparedness and resiliency for vulnerable populations and save lives. The situation is getting worse. Some $63 million of federal support for local health agencies is ending. And within months, many local health agencies are losing about 40% of their annual funding. At the same time, with reductions to Medicaid funding and health insurance subsidies, local health agencies are going to become the provider of last resort for child health, women's health, vaccines, and other preventive services. We know that public health is return on investment, and every dollar invested in public health reduces other social and healthcare costs by up to $14. Given those identified gaps, I recommend that the CRC-CEF allocate significant funding, knowing that we have $60 to $80 million in unmet needs, as a down payment towards support of local health agencies and their life-saving work to reduce health disparities. Thank you.
Thank you. Okay, next up we have Ken Wolski. Hi, Ken, I see you. Donna, we will come back around. Ken, you should be able to speak now.
Good afternoon, commissioners and members of the Cannabis Regulatory Commission. My name is Ken Wolski. I'm a registered nurse and executive director of the Coalition for Medical Marijuana New Jersey, CMMNJ. The headquarters of CMMNJ is in Mercer County in Trenton. CMMNJ is seeking funding from CEF to continue our work. Our three main goals for medical cannabis are: 1, insurance coverage; 2, hospital and institutional access; and 3, home cultivation rights. CMMNJ is an all-volunteer 501c3 educational organization. On our 20th anniversary in 2023, CMMNJ was recognized by a joint legislative resolution as a, quote, catalyst for the legalization of both medical marijuana and recreational marijuana in this state, unquote. Unfortunately, donations to our organization have declined significantly since legalization. People think our work is done. But there are still countless patients here who qualify for medical cannabis, but who lack safe, legal, and affordable access to it. Our first goal, insurance coverage, will exponentially increase the number of patients in the medicinal cannabis program. Imagine the positive difference it could make for patients who would only have to pay a $15 copay for an ounce of cannabis from an alternative treatment center. Insurance will make medical cannabis available to those who were born into poverty or who were impoverished by their life events. CEF funding is meant to enrich inner cities, and a healthier inner city is an enriched inner city that is poised for economic progress. Our second goal is hospital and institutional access. Currently, patients in New Jersey hospitals, nursing homes, state institutions, group homes, and hospice are forbidden to use medical cannabis. It is inappropriate and dangerous to stop patients from using their medical cannabis treatment when they enter a facility. I've been a registered nurse for 50 years. I've worked in several hospitals and for 25 years in state institutions. I know that staff in these facilities are trained to administer, account for, and evaluate the effects of controlled substances. Medical cannabis can and must be integrated into a patient's care plan. The institutional caregivers that were called for in the 2019 Jake Honig law should be implemented immediately. Our third goal is home cultivation. Legal access to a small number of plants or a small area of cultivation is extremely important for some patients, estimated to be less than 10% of all medical cannabis patients. Home cultivation guarantees affordability, but also guarantees access to strains of cannabis that are specific to a patient's condition. Greater access to medical cannabis will reduce healthcare costs in this state. Medical cannabis treats and stabilizes multiple conditions. This will result in fewer prescriptions needed, fewer emergency room trips, fewer hospitalizations, and fewer surgical procedures. Achieving our goals will make New Jersey healthier and wealthier. Thank you for considering SEAF grant funding to the Coalition for Medical Marijuana in New Jersey.
Thank you. Next up, we have Leo Bridgewater. Leo Bridgewater. Gabriel Gouache. If you're in the room, press *9 to raise your hand. Gabriel Gouache. Edward Grimes. Okay, I see you, Edward. You should be able to speak now, Edward.
Good afternoon. This is Edward Grimes. I'm a board member of Sativa Cross. We're a 501c3 here in New Jersey, fighting for disability rights and for cannabis patients' rights. And we've been asking the CRC for years to subsidize wheelchair access for all disabled vets and all people in wheelchairs. There's dispensaries opening up in all counties without wheelchair access. And now you're going to have lounges opening up. And it's a workaround with the ADA because the ADA allows older buildings to be grandfathered in. But the CRC, with the stroke of a pen, could allow many disabled vets to get the access that they deserve. You wouldn't have this committee without disabled vets fighting for your rights. So I think we need to do better for our vets. I've been saying this for years, and it seems to be falling on deaf ears for years, but hopefully there's new commissioners in there that will listen to us. Now, I'm also a consultant for Mad Hatter, and I'd like to see if you guys can bail out Mad Hatter because they have done nothing wrong. They have broken no laws. They have been not fined by anybody. The CRC has injected themselves into a personal battle between the town and Mad Hatter. They're trying to use eminent domain to take over a street called Belgrade Avenue to take over that property. And they're not supporting Mad Hatter's license. They're supporting that big MSO, but they're not supporting Mad Hatter, who's a small mom and pop shop who's been there for 50 years under another businesses. They've been paying taxes for years. So will the CRC bail them out? Will they give the people that have lost their jobs? There's people lost their jobs. There's a bunch of product that's being wasted right now. That's just sitting there, has to be thrown out. There's taxes that have to be paid. There's a lot of, I mean, why is the CRC not supporting Mad Hatter? They took their support away for no reason, and they're not returning any calls. And we'd like to know what's going on and how, we can fix that because people are out of work. So please help. Thank you very much.
Okay, moving on to, I'm going to go back through the list. George Worley. George Worley. Prince Abadoye. Prince Abadoye. Benjamin Guy. Benjamin Guy. Paul David Roman. Paul David Roman. Christopher Keim. Christopher Keim. Stephen Von Olen. Stephen Von Olen. Diego Segura. If you're in the room, please press *9 to raise your hand. Diego Segura, Nichelle Santos, Nichelle Santos, Donna Lisi. There we go. I see it, Donna. You should be able to speak now.
Thank you, Commissioner. Good afternoon. My name is Dr. Donna Lisi. I'm a board-certified psychiatric pharmacist, a member of the Executive Committee of the New Jersey Local Chair of the Franklin Township Board of Health Advisory Council, and Chair of the Somerset County Local Advisory Council on Alcohol and Drug Abuse. I also serve as an expert affiliate on the Expert Affiliate Council for ISAC, the International Academy on the Science and Impact of Cannabis. Today, I'm here in my capacity with the local New Jersey Local Boards of Health Association. New Jersey's legalization of adult use cannabis included a commitment to social equity. The question today is how social equity excise fees revenue can be invested to prevent avoidable harm, particularly in communities already facing health disparities. New Jersey's own data show that public health education is urgently needed, as it is underfunded. Since legalization, pediatric cannabis exposures reported to the New Jersey Poison Information Education System increased from 138 cases before legalization to 408 cases after. That's an 89% increase. These exposures are overwhelmingly unintentional, often involving edible products, and are highly preventable through education on safe storage and use. I have published a paper in a national pharmacy journal on pediatric toxicity from cannabis edibles. Cannabis-related harm is also visible in healthcare utilization. A peer review analysis of New Jersey Emergency Department data from 2019 through 2022 found that cannabis-related emergency visits represent a measurable and ongoing burden. The vast majority of visits for children aged 0 to 12 years were related to accidental cannabis exposures, often a household member's edibles. These visits frequently reflect misunderstanding of the delayed onset, dose stacking, and panic reactions from parents. Again, educational gaps. Education is a proven front-end strategy to reduce harm. Schools are also affected. The New Jersey Department of Education reports that marijuana is the most frequently reported substance involved in school-related substance incidents, with 5,309 marijuana-related incidents in 2023-2024. In addition, 17% of New Jersey high school students report current marijuana use, indicating widespread youth exposure during critical developmental years. The clinical literature consistently shows that frequent and high-potency cannabis use increases the risk of acute psychotic symptoms, particularly among young people. This underscores the need for education on mental health, warning signs, and risk factors. Harm that are largely unintentional, behavioral, and preventable. That makes public health education, not enforcement, the most appropriate, equitable use of social equity excise fees. Investing excise fee revenue in education would support safe storage and edible risk, delayed onset dosing and impairment and prevent impairment from these products, as well as train health professionals to counsel patients before harm occurs. Thank you for your time and your consideration.
Thank you. Leo Bridgewater, if you're in the room, press *9 to raise your hand. Leo Bridgewater. Gabriel Gouache. Gabriel Gouache. Commissioner, that concludes our speaker registrations.
Thank you. I just want to thank everyone who spoke today. I want to thank the CRC team. I want to thank those who took time to participate in today's hearing. I also need to say, please reach out to your legislators for further conversation regarding SEAF. We take your information here and we pass it on to the legislature and the governor. We do not decide how funds are spent, but please, your voices are also heard when you reinforce the information that we send to the legislature and the governor by reaching out to your local legislature. Again, I want to also repeat that I want to remind you that the final hearing in this series is scheduled for Wednesday, January 29th at 2 p.m. Please feel free to spread the word. Today we have had about 8 speakers. We've had a lot registered, but did not show up to speak. Please show up to speak so your voices can be heard. Pass the word on so that we have as much participation as possible. Thank you again to everyone. Have a great evening. Take care.